You know, the word health equity, first of all, the word equity has been so polarizing and can be so political. And several years ago, when Morehouse School of Medicine we did our big strategic planning session about 8 years ago, and we decided that our vision statement would be leading the creation and advancement of health equity. And we used the words creation and advancement intentional. Sometimes we will be needing to create new solutions. Sometimes we would just be needing to complement and add our assets to those solutions. But that solution of health equity is defined by giving people what they need, when they need it, and the amount they need to reach their optimal level of health.
You're listening to the Health Disparities Podcast from Movement is Life, being recorded live and in person at Movement is Life's annual Health Equity Summit. Our theme this year is Health Equity, Solutions from Healthcare Leaders. I'm Dr. Carla Harwell, Vice Chair of the Board of Movement is Life and the Medical Director of University Hospital's Otis Moss Jr. Health Center in Cleveland, Ohio. Today, we're diving into the topic of health equity with someone who has a wealth of knowledge and experience with this issue, Dr. Valerie Montgomery Rice. Dr. Rice is the 6th president of Morehouse School of Medicine and an esteemed infertility specialist and researcher. She's also the founding director of the Center for Women's Health Research at Meharry Medical College. Dr. Montgomery Rice, thanks for being here.
Thank you for having me.
So tell us a little bit about yourself and how did you get into medicine to begin with?
Well, I am from Macon, Georgia. I was raised in what I describe as a small town, single parent, 3 other sisters, and my mother worked at a paper factory, and she worked for 25 years working the swing shift. And one of the things that she told us was that education would be the equalizer for us to leave Macon and to have choice. She was really into choice. She only graduated from high school, and she really wanted more for our daughters. Now, I decided to go to Georgia Tech back in 1979 when I graduated from high school, and the only reason I went to Georgia Tech, having been a student in the honors program, et cetera, and graduating from a high school at that time, which was the largest high school in the nation, Southwest High School, had the best basketball team in the nation also. We really did win the national championship. And so my science teacher said to me, you're good in math and science, and they're looking for more kids to become engineers, black kids, so why don't you go to Georgia Tech? That was the extent of the counseling that I had, even though I'm pretty sure I did pretty well on the SAT, et cetera. And so I came to Georgia Tech. And I started co-oping immediately that first summer in chemical engineering with Procter & Gamble in Ohio. And I at the Sharon Woods plant. And they offered me a job after about 5 quarters of co-oping. And I became immediately terrified because I thought, there's no way that I want to be a chemical engineer. And so I went to the encyclopedia. And if you look up, remember the encyclopedia where you look up the keywords? And I looked at math, science, and people, and medicine came up. And I decided to go to medical school. Wow. I called my mother. It was a long-distance call. She thought I was crazy. My advisor at Georgia Tech thought I was crazy. But I knew that I did not want to be an engineer, and that this was all about choice, right? That's what she had taught us all our life. And so really, I came back to Georgia Tech. There were no pre-med majors. And I remember going to talk to my advisor. He said, why don't you just go ahead on and graduate with your engineering degree? It was a 5-year program. And he said, then if you still have this itch to go to medical school, you can do that. I said, once I started getting that paycheck and shopping, it's over. So I said, no, I probably shouldn't do that. So I went over to Spelman College and talked to the advisor there. And I'm talking to the pre-med advisor, and she looks at me and she said, you don't seem to know a lot about going to medical school. And I said, well, I didn't know a lot about being an engineer, and that's working out okay. And she actually did help me get into a summer program at Harvard Medical School. I recognized you had to take the MCAT. And so I took the MCAT, didn't really prepare for it, but at Georgia Tech, which was the hardest school in America, in my opinion, I did pretty well and ended up going to Harvard Medical School. So it was really just, I think, having no fear and being naive.
Unbelievable.
Yes.
And I saw one of your podcasts, and you talked about that little pink house,
Ooh.
Grandma's house.
Yes, Grandmama's
and
house.
And listening to your story, I can just see how that also played an integral part. And when you said the word fear,
Yeah.
have no fear.
Have no fear. Be
So,
fearless.
Wow.
And that's what I saw. That's what I saw growing up. My mother left an abusive relationship, did not understand probably how she was going to make it the next day, but she didn't want that life for her kids, for her daughters. My grandmother, who lived in the country in that pink house where we would spend all of our summers, which was quite challenging. No fear, and how she would send us to that chicken coop.
Yep.
And it was your time.
And see who could win.
That's right. It was your time.
You are the chickens.
Right. It was your time to go pick up the eggs, Valerie. And I was like, oh, no, Grandmama, no. She said, I know it's your time. Okay?
Wow.
And that same chicken sometimes became our dinner. Unfortunately.
Oh, that's wonderful. All right, you have an incredible amount of experience in many arenas, from patient care and medical research to organizational management and public health policy. Tell us about so you've told us about your career journey to become a physician, but how did all these other interests evolve?
It was really very organic. I really loved science, and I loved people. And medicine gives you that platform to be able to live out what has become my purpose. Now, I wasn't bright enough at that time to understand that it wasn't what I was doing. I was just really following my heart, connected to my mind, and really letting it be a part of my spirit. And so when I took my first job after fellowship, so I sort of knew early on that I was probably going to do academic medicine, because I spent my entire fourth year of medical school doing basic science research. I was looking at purified hormones and how they would induce what we call superovulation. So I was pretty clear that I was going to do academic medicine. And so I chose to come do my residency in OBGYN because Emory allowed me to bring my research with me. So I could, as an intern, I would be at Grady working every other night like we did as interns. No 80-hour work week, believe me. And then I would be going over to the lab across the street, injecting my mice to continue my research. And so I continued to do that research throughout. And then I knew I was going to do a fellowship in reproductive endocrinology and fertility, because I really enjoyed the opportunity to bridge what was possible for creating opportunity for families, women who were having reproductive disorders to achieve pregnancy, and then the surgical approach, as well as the endocrinology disorders that were associated with it. And so it was a great bridge for me.
It was a perfect storm.
It was a perfect storm. And so I took that first job at the University of Kansas. And they hired two people, myself and another guy, and we were fresh out of fellowship. And we were rebuilding the division. So I had to gain some administrative skills. And so I relied on the AAMC, the Association of Academic Medical Colleges, and I went to every one of those development courses over my career. And there are so many things that you learn, not just about the finances of academic medicine, but you also learn the people. And it is really always, as I've found, it is about the people. And so every one of my roles that I have taken has been about how do you bridge this understanding of how to invest and develop people in order for them to bring their best self to work. And if you have a shared mission and vision, you can accomplish great things for the organizations.
Wow. So you're one of our plenary speakers here at our annual Movement is Life Summit. Give us a little snippet about your message that you decided to bring to us today.
It will be centered on health equity. I was so happy to hear your topic. You know, the word health equity, first of all, the word equity has been so polarizing and can be so political. And several years ago, when Morehouse School of Medicine we did our big strategic planning session about 8 years ago, and we decided that our vision statement would be leading the creation and advancement of health equity. And we used the words creation and advancement intentional. Sometimes we will be needing to create new solutions. Sometimes we would just be needing to complement and add our assets to those solutions. But that solution of health equity is defined by giving people what they need, when they need it, and the amount they need to reach their optimal level of health. Now, for some people, that is addressing the social determinants of health. That's addressing access, that's addressing transportation, that's addressing child care, it's environmental challenges, etc. For some people, that may be access to the greatest new immunotherapy for breast cancer treatment. For some people, it may just be about increasing their knowledge so they can make different lifestyle choices.
Right.
The most important thing is to meet that person's
need
where they are. And there's nothing political about that. Now, in my talk, I will talk a little bit about the political determinants of health because they are tied together. There have been systemic policies that have been put in place over the years that have continued to influence the social determinants, which then lead to people not being able to capitalize on opportunities.
That actually was my next question, because in the U.S., the wealthiest Americans own an increasing share of wealth, and so I'm glad that you're going to expand on that correlation between health and wealth.
That's right.
One of the things you're most passionate about, I believe, is building a pipeline, right, of people of color in medicine and science.
Yes. Yeah.
What do you see as the greatest barriers to diversifying the healthcare workforce? And what do you think it takes to overcome these barriers?
I think it's two things. I think it's will and opportunity. So when I think about the fact that I graduated from a high school in Macon, Georgia, and my class size was 1,049. My high school class was 1,049. There were only 3 high schools at that time and 1 small private school in Macon. And I think about the opportunities that I've been able to capitalize on that have created the will for me to move through those opportunities to accomplish what I am, who I am today. I think about, what if everybody was given that opportunity? What if everybody was told that you can be anything you want to be? I'll never forget this. Satya Nadella, who is the president of CEO of Microsoft, came to speak to at the Atlanta University Center. And he said that growing up, he had the opportunity to be curious and to fail without consequences. What if every child was given the opportunity to be curious and to fail without consequences? Now, that doesn't mean that he got rewarded for those failures, but it also didn't mean that that was going to be so life-changing that he would not be able to realize his potential. And so when I think about it became very evident to me when I was the dean at Meharry Medical College. Now, when I was at the University of Kansas, I rose to be a tenured professor, and I was really still into my research. I was the division head. And then when I moved to Meharry and became the chair of OBGYN, and we were restarting the residency training program, what really perked my interest to take that job was at that time, Meharry Medical College was at Nashville General Hospital for their clinical care. The OBGYN program had been shut down for about 7 years. And I walked into that place and I said, why is it that 18 out of 75 students are going into OBGYN? They have no residency training programs, and they have 10 faculty members. And then I saw the interaction. I saw the exposure. I saw the engagement. I saw what was being, let those students know what was possible for them. And I said, okay, what if there were more students given these opportunities? And so and then I recognized throughout my journey that you have to create, and we always have this controversy, a pipeline and a pathway. So we need students to believe in what's possible starting in the first grade. And then we have to help them chart a pathway. So we have Tuskegee Airmen Global Academy here, TAG Academy, which is a K through 5 school. They have about 20 students in the pre-K program. And we adopted this school 10 years ago. So we have a mentoring program there. We have about 100 or so of our employees who are in that school every day, supporting the teachers around issues that are important and how they can move these students to. Now, you may say, well, why would you all invest in a K through 5 school? Because it's about what's possible. Now, if only 10% of those students eventually become doctors, we're good.
You're good, yeah.
But if 100% of them graduate, we're really good.
That's right.
And so when we took over that school and became a part of that family 10 years ago, they were a failing school.
And what better place to begin?
Right. And we have been in there, and I'm not saying that we are all of the success, but I know that we've been an integral part of it. And it is now an Apple Star rated school. Oh. And we go there and we can see the impact. We can see the reading proficiency. We can see the math proficiency. We can see the aspirations in the students' eyes. And they come to our school 3 times a year. Oh. And we host them, and we're doing science projects, and we're doing a whole type of things.
And they'll be what they see.
Right.
They'll be what they see.
Exactly.
They'll be what they see.
And so we have programs throughout. So we have K through 5, we have middle schools, we have high school programs, we have pre-med programs, pre-PA programs, pre-science programs throughout. And then, of course, we have the medical school and about 15 other degrees there. And so we've just created all of these different pathways because medicine is a team sport.
It certainly is.
And it requires everybody to be able to operate at the top of their license in order for us to achieve optimal health for everyone.
That is just phenomenal.
Thank you.
Oh my gosh. Tell us about the More in Common Alliance and the kinds of solutions that you feel need to be prioritized in order to advance health equity in our nation.
So it's just really focused on the More in Common Alliance is a partnership between Morehouse School of Medicine and Common Spirit Health, which is the second largest health system in the country. They have about 140 plus hospitals in about 28 states. And so in the middle of the pandemic, we were growing, still growing. Morehouse School of Medicine thought that it might want to try and buy 2 hospitals that were going to close here. And we don't know how to run hospitals, but I knew some people who did. And so I went to a former board member who at that time was the CEO of Dignity Health, CHI, Catholic Health Initiatives, and Dignity Health. They were just forming. They were forming Common Spirit Health. And I asked them would they loan me 2 executives to serve on a team to help us do the due diligence of these hospitals. Again, we didn't know how to do this. And they said yes. And throughout that process, they became they had co-CEOs, they became one CEO, which was Mr. Lloyd Dean. And Lloyd and I started talking almost every Saturday about, he was advising what we should be thinking about, his team members were working, and then George Floyd happened. And he and I both decided that we can do something of impact while we're sitting in the seats that we are humbly being able to sit in. He had a bunch of hospitals that did not have providers that looked like the community they were serving. Morehouse School of Medicine has a strong track record of recruiting people from underserved communities, regardless of their race and ethnicity, and influencing their decisions to go into primary care and to practice back in those communities. And so we thought we would bring those two assets together. So we went to our teams, we formed these work streams, 5 work streams, and we decided to open up 5 regional medical campuses around the country at their hospitals. So students would be recruited from those communities, go to college, come to Morehouse School of Medicine for their first and second year. And their third and fourth year, they go back to those communities, located at those hospitals. And then we are building out 10 GME programs around the country. Because you know the key to someone practicing in a community is where they do their graduate medical education, right? And so we're very, very clear about that. And so we've started this, and we're in our 4th year. We have the Seattle campus that's being built out, a campus in Bakersfield, in Chattanooga, and Kentucky. We haven't picked the 5th campus, and we just launched our first graduate medical education program in family medicine in Santa Cruz. And none of those first residents are African American. And that was not a problem for us. Why? Because 3 of those persons are from that community, and several of them are Latino. And that is what that population and that demographics looks like. So we're holding true to our mission of why are we doing this? We're doing this so that in those hospitals, there would be providers who are tied to those communities, who are of that community.
They look like the people that they're caring for. Exactly.
We believe that is key to cultural competency and cultural humility.
Absolutely.
So that's what this initiative is about.
Absolutely.
And Common Spirit Health gifted Morehouse School of Medicine $115 million over 10 years to lay the foundation, and we're trying to raise an additional $100 million to support this so it is sustainable forever.
That is absolutely phenomenal. Absolutely phenomenal. I just stand in awe. When you think about the direction we're headed as a nation in terms of health equity, diversity in healthcare, addressing health disparities, all the things that are near and dear to your heart, what gives you hope?
You know, that is a very interesting question. And I was at an event a couple of nights ago, and it was the Black Women Resilience Project. And I looked in the audience, and I saw all of these Black women physicians and Black women who were aspiring to become physicians or enter into the healthcare space. And I spoke to them about choice. And I spoke to them about how they actually can control their destiny. The one thing that I've been clear about is that we are not necessarily tied to our history so much that it cannot positively change your destiny. You use it as a reference point. You use it as an opportunity to learn from. You create what I call a board of professional advisors. And professional, I don't mean somebody with a college degree. I mean somebody with wisdom who can help you to navigate the system. But most important about all of this, I think in this day and time, people are recognizing how much we can be a resource to one another. If we're willing to be vulnerable and to be transparent in what our aspirations are. So when I looked out in that room, I saw women who were disappointed in what had happened in the election. I saw people who were concerned about, are we going to shut down all DEI? Okay, well, let's not let those terms be politicized. Everyone knows, and I sit on a corporate board, when you have diversity at the table, whether it's by race, ethnicity, gender, distance traveled, expertise, experience, the performance of the company is better. You meet your profit goals,
Yeah, you meet your goals.
your revenue goals better, quicker, more efficiently, and more effectively. And effectively means that you get to serve that population who is the recipient of your product line better, because you have people coming to the table asking you to think differently about your why and your how and who it's going to impact. Medicine is no different.
No different.
In fact, it's even more important to have diversity in medicine, because I have to build a relationship of trust with you. I tell my students and people who I get to engage with on a regular basis, the most important question that you should ask when you sit in front of somebody in any circumstance, based on who's sitting in front of me, what's possible? Based on who's sitting in front of me, what's possible? If you ask that with every engagement, it forces you to put yourself second and that person first. And then you don't have to memorize the review of systems. It comes naturally.
It comes, yeah.
Because you're thinking about, well, how did this person get to the office today? What is really their chief complaint? I'm going to give them this prescription. Would they have a challenge getting this filled? Or maybe they are some high-flying executive who's on a plane every other day. Should I be thinking about giving them an exercise protocol for movement, right?
Right.
When they're on this plane?
Right.
Should I be thinking about the fact that maybe they don't have a safe place to go and exercise? Should I be coming up with different strategies for them? Because based on who's sitting in front of me, what's possible?
That's awesome. That's awesome. All right, we have a little bit more time. I got wind of something called Danforth Dialogues.
Oh, yes, yes.
That you do monthly, podcasts.
Yes.
Tell us a little bit about that.
So in the middle of COVID, again, COVID was just, my mother would say, never waste a crisis, right? And we decided we were not going to waste this crisis. During COVID, Morehouse School of Medicine became even more involved in the community. We started getting calls from people because of our clinical research. Could we do the vaccine trials and da-da-da? So we did all the vaccine trials. We were with the Department of Public Health here in the state of Georgia. They asked me to stand on that council. I became the health equity champion for the state around this. And we started early on testing and then being able to provide the vaccines, okay, and doing the trials. And so I was very clear, middle of March when everything shut down, that we can't educate and train medical doctors over Zoom.
Right.
And I had one part of my organization that was the education administration part. Yeah, we could probably work from home for a moment, but my doctors, our doctors were there at Grady and Choa and the VA, and they were working their butts off, and they were coming home, changing their clothes in the garage, concerned about infecting their children. And we were getting hotel rooms. We were doing all of these things for them. On the education administration side, though, I was thinking, okay, we can't educate and train these students just on Zoom, so we got to get back to work. So and it was probably 4 days in the middle of the pandemic, I called up a friend of mine, Akmal Narati, who is the CEO of Color Genomics, and I said, I know you're going to change your genomic platform to doing COVID testing. And he said, yeah, Valerie, we're about to do this for the city of San Francisco. I said, Morehouse School of Medicine and the Atlanta University Center needs to be your first education entity that you do it. with. So we took our Campus Shield app and we turned that app into our safety app that people had to answer all those questions in order to come on campus. And then we put a testing protocol together and we started testing people. So we tested twice a week, everybody. Then we expanded that to the Atlanta University Center. And the Atlanta University Center presidents and I, who were already doing a lot of things together, we became very strategic about how we were going to get our students back into the classrooms and our faculty and our administration back safely. And I saw leadership at its best. I saw leadership around collaboration. I saw leadership around overcoming fear. I saw leadership through empathy. I saw leadership through strategy. And so we decided to start the Danforth Dialogues to tell the story about leadership. And so we have expanded that to a host of leaders around the country for them to tell their story, yes, about what happened during COVID, but then beyond that. And what are the things that have happened in their lives and through their childhood? And one of the common things that happens during the Danforth Dialogue, everybody has a story about their childhood and how that really has laid the foundation for them to be who they are.
Absolutely.
So that's why I know that nurturing at TAG Academy,
it's the right thing to do.
It lays the foundation about what's possible.
Absolutely.
And so that's how that started.
Absolutely.
Yes.
As you were telling your story about your journey, it reminded me so much of my own journey, which, you know, my dad was from a small town called Mason, Tennessee, had one stop sign, not even a stop light. And he too knew that education was the key.
Yeah.
And, you know, moved up north to try to make a better life for himself and his future family. So your journey has just been phenomenal, Dr. Montgomery Rice. We're so happy to have you here with us today. I'd like to thank my guest again, Dr. Valerie Montgomery Rice, for being with us today. You can find links to more information about Dr. Montgomery Rice at the link in our show notes. That brings us to the end of another episode of the Health Disparities Podcast from Movement is Life. Dr. Montgomery Rice, thank you again.
It's been my pleasure to be here. Thank you, Dr. Harwell.
I'm Dr. Carla Harwell. Until next time, be safe and be well.